Jessica, Tashawn, Vanessa. I know you're not able to get into the room until right at time, so we'll give it just a minute before we get set up. Certainly give Professor Lavalle a moment. All right, Professor Lavalle, I think I've just promoted you to a moderator. So hopefully you can get on your microphone. Welcome again, everyone. I'm putting a link for our attendance sign-in into the chat while we're getting underway here. If you wouldn't mind popping open that link and entering your attendance. We always like to know who's coming. Let's see. All right, it looks like Professor Lavalle has got his microphone connected, getting there.
Yep, I am here.
Fantastic.
My apologies. I didn't know that I was in the room. I was looking at something on another slide.
Right when you're waiting to join, once the time hits, it just slips you in, and it takes me by surprise as well because it automatically starts recording right at time. So it kind of just happens. All right, so welcome everyone. As I said, this webinar is now being recorded. If you would like to access the recording after the event, it will be shared on the Purdue Global Student Webinar calendar. There will also be a takeaway at the end of the webinar that will include any links we've shared during the webinar, as well as a copy of all of the slide content. So again, welcome to tonight's webinar hosted by the Learning for Success Center. Tonight is the very first session of our mental health awareness series, and we're delighted that you've joined us. Our presenter tonight is Eric Lavalle, an adjunct professor of psychology and a licensed therapist. Professor Lavalle is here to talk about some of the stigmas surrounding mental health, including the challenges that poses for practitioners and the barriers it creates for those who are seeking treatment. So Professor Lavalle is here to tear down some of those stigmas and bust some myths. So without any further ado, I'll turn it over to him now.
Fantastic. And let me get my webcam started. We'll see if we can bust down some of those myths. Good evening, everybody. Welcome. Belinda just said, welcome. Pleasure to see you all here. And yeah, we're going to be talking about a lot of different myths in the mental health field, or dealing with mental health, mental illness, treatment of mental health, and all that really wonderful and fun, well, not necessarily wonderful and fun stuff, but interesting stuff at the very least. And obviously the big challenges that are presenting us as clinicians, us as individuals, people regardless of whether you're in the mental health field or not, but just as individuals in their pursuits seeking mental health treatment. Let's see, I can't control the slides. There we go. But I will kind of give a little bit of a background, just kind of talk about my experience, because some of you may have had me already or not, but also just kind of get an understanding of where I've kind of come from and some of the stigma that maybe I've kind of even witnessed and experienced along the way. Obviously, I have my bachelor's and master's degrees in psychology and mental health counseling. While I was working, after I earned my bachelor's degree, I started working at a psychiatric hospital, which even just saying psychiatric hospital presents some level of stigma in everybody's mind, right? I'm willing to bet that a lot of you have maybe seen some TV shows or heard some horror stories about things that have happened in psychiatric hospitals. Thinking about maybe like the old asylums, if you will, which we'll be talking about this evening as well. Just some of the maybe like poor treatment that maybe people have received in dealing with their mental health and mental health treatment. And the last thing that anybody who's maybe dealing with any sort of mental illness would think about, like, well, I don't want to end up like that. I don't want to go to a place where maybe I'm abused or mistreated or something along those lines. Luckily, we have made a lot of strides. Spoiler alert, we've made a lot of strides in those areas, but that's still part of that stigma. Is thinking about work, being at a psych ward or something along those lines. When I tell people that I work night shift at that psychiatric hospital, they're like, "Oh man, that must have been really a really weird, really interesting time, really challenging time." And fact of the matter was, most nights it was just us trying to keep ourselves awake. It wasn't as interesting or as stigmatized as maybe people would usually would have well thought it was. So that is definitely something that really even kind of comes to mind. Even the first thing that I kind of even talk about with regards to what I've even done in my career. I actually worked in a lot of different areas as well, but that's one of the really big and key things I really wanted to kind of highlight, at least early on, was that that the stigma around mental health treatment and maybe the more severe mental health treatment, that it's something like out of a TV series that was based in like the 40s or 50s about mental health care is still like that. No, it's not really like that anymore. We're not psychiatrists and doctors and nurses in those facilities. They're not doing experimental treatments and lobotomies and stuff like that. And we've again made a lot of advancements there. Also, let's see, is there anything else that here I really want to kind of touch on regarding anything like that stigmatized? Not really. No, not really. So just all that experience up there, but we can go to the next slide at this point. So some of the things we will be touching on tonight, just kind of everything around stigma, right? So we're gonna be learning about the early perceptions of mental illness. So things even well before even some of the things that we even talk about in the psych classes. I know in like our, we talk about the history of psychology, talking about like the 1800s and 1900s, just before Freud and about Freud. We feel like a lot of people are like, yeah, that's the start of psychology. Well, that's not the start of mental illness. So obviously there are challenges with regards to mental illness dating way back even before some of our fine psych friends came around. So we'll talk about some of those early perceptions around mental health, mental illness, and the struggles it was for those people to adapt in society. We'll also explore the different types of stigma as well, that there's more than just, there's more than just one type of stigma. It's not just sort of a general term, that there's even specific stigmas within the field of mental health and the stigmas around mental illness. We'll also talk about the effects of stigma. Outside of deterring people from treatment, there are a lot of other things that stigma can do, or the stigma of mental health and mental illness does. And then additionally, we'll be talking about how we can overcome stigma and how things have maybe kind of shifted a little bit into working on overcoming that stigma. There's been a lot of really interesting things that have kind of happened a little bit. It seems like things have kind of, things are kind of, seem like it kind of ebb and flows, if you will, when it comes to mental illness. Sometimes it's front line of the news, and it kind of takes a backseat for a little bit. Obviously, other things going on in the world that are relatively prevalent more recently, but it doesn't mean that we're still not trying to break down some of those barriers of the stigma and of mental illness, and trying to be able to provide better mental health care and treatment for individuals. So some of the early perceptions of mental illness, kind of mentioned this already, is that it's kind of along the same lines of a lot of what maybe you would think, right? That, if somebody is exhibiting maybe a much more severe mental illness, that it's going to be that people are going to feel like that it's some sort of demonic possession or some sort of religious punishment, if you will, that this person did something at some point in their life that was so heinous that they're now being punished by the Lord above, or by some sort of demon that is taking over their body. Think about maybe leading them into some religious treatments, if you will, like exorcisms or things along those lines. So those are some of the very early views of mental illness, people dealing with mental health disorders, and you think about what some of the severe mental health disorders do involve, like seeing or hearing things that aren't there, or sort of having the word salad, if you will, saying sentences and words that don't really make sense. And if you're in the early human life, if you will, or not early human life, but earlier times, if you will, you're going to kind of maybe think that, like, yeah, religion is a really big part of culture and society, and this person's maybe possessed by a devil or a demon. So that were some of the really early kind of views of mental illness in, really dating far, far back. That's how it was kind of perceived. Then we kind of lead into the 5th century a little bit, and things kind of shift a little bit. That our good old friend Hippocrates from philosophy focused a little bit more on non-religious reasons for mental illness. Up until this time, a lot of it was sort of believed that it was a more of a religious aspect, that there was some sort of punishment from God or demonic possession. But he felt like that maybe there's some other aspects, some other contributing factors into what's going on here. So kind of thought about things like environment, occupation, and offered substances as treatments. I can't remember any of the specific substances he tried to use back then, but I do know that he was trying to do some really groundbreaking things, thinking about things a little bit more differently. And it's funny that that's something that happened a long time ago, but still that there was this still feeling that kind of ongoing, that there thought that there was this religious aspect to mental illness. And that kind of talks about, or leads to the next point, about the Middle Ages, if you will. So even though Hippocrates kind of tried making some ground in that area, it didn't nearly make as much ground, as it was still kind of reviewed as a demonic possession, even through the Middle Ages and going on from there. And negative perceptions of mental health and mental illness continued even into the 18th century. So not really too long ago. We're talking about the 1800s here, where there's still strong negative perceptions against mental illness. And we're talking about this going way back at this point. This is hundreds, thousands of years at this point. And again, these negative perceptions led to poor treatment and unhygienic living conditions for the individuals that were perceived to have been dealing with some sort of mental illness. Obviously not necessarily knowing it was a mental illness at the time, but struggling with mental illness, but presenting with it, with symptoms that society kind of led them to feel like that they were being possessed by a demon. It was definitely a very challenging time, very poor treatment of these individuals, sort of cast away from society as well. And kind of forced to do things that they didn't really want to do. Really wasn't a good time in human history to be dealing with some sort of mental health crisis or mental health struggle. And obviously that negative stigma didn't necessarily continue to be negative, if you will, going forward and into the 1900s as well, or as we end the 1800s and into the early 1900s as well, where we started to have more mental health hospitals. So hospitals for just people dealing with mental health issues. Eventually that became the asylums, if you will, which are very interesting places to visit because they're abandoned, and it's just kind of very fascinating to see what the living conditions were for those individuals. There's an abandoned one in West Virginia. Got to take a tour of it one time. Fantastic, very interesting. If you ever want to kind of see how things were from like the early 1900s until about the 1990s for mental health treatment. Definitely recommend something like that. But anyways, so there were with regards to mental health treatment, there were some really poor living conditions with many for many who experienced mental illness, as we kind of talked about previously. That continued into this time when there were hospitals that were built to now house these individuals dealing with a mental illness. And the big thing that kind of comes around this time is obviously the treatment. There were these people were put in there where they could receive care that was considered the best options, and also was considered a weight off the family's shoulders, because a lot of times, again, they were either cast out from society or they were being taken care of by the family, and that was definitely putting a lot of strain on family members. So a lot of times they would say, we're gonna take you and put you into this hospital. They can take care of you. They're the experts. And a lot of times families would not visit the family member that they put into the hospitals. So it's not just like, okay, you're in a hospital, we'll visit you every week or whatever. It was, you were there and you might not see your family again, depending on what the illness is and depending on the severity of it as well. So that is one of the big things that would kind of happen, as well as, these were maybe a lot of times considered places for long-term stays. Obviously, hospitalization, just kind of throwing a lot of people into these hospitals. Eventually, the conditions continue to get worse as more and more people start to crowd these hospitals over time. This is something that, again, didn't just happen immediately. This is something that happened over many, many years, that these hospitals would continue to get more and more individuals, clients put into them, and the living conditions just kind of naturally got worse. The professionals, if you will, that were there to treat the patients, if you will, the quality of the people continued to get lower and lower and lower, because they needed to find people to bring in. And when you do that, people aren't necessarily as vetted, background checks, stuff like that, and this is where a lot of abuse started happening, unfortunately. A lot of really difficult and challenging things started happening for the individuals who were living there. Physical abuse, sexual abuse, and ultimately, countless deaths even. And I know that the asylum that I visited in West Virginia, they even had a cemetery on the premises for the individuals who passed away there, because they didn't get taken to a cemetery for their family, couldn't find the family sometimes. So that was a lot of the treatment into the 90s. Starting in the 50s, these state-run hospitals started to close due to funding and also improvements with medications. So that's one of the big things that's kind of helped with the stigma a little bit, has been improvements in medications to treat a wide variety of different mental health issues. We have treatments that can manage even some of the most severe mental health issues for many people, like even paranoid schizophrenia and bipolar. Those are definitely options that can be treated with medications. Unfortunately, not necessarily the case for everybody at the same time, but because of these medications coming out in the 30s, 40s, and 50s, it really allowed people to not have to go into these hospitals for an extended stay or lifetime stay, and they were able to be fully functional people in society. And it wasn't, again, just people with like a schizophrenia or bipolar who were in these hospitals. People with depression and anxiety were also there as well. So again, not just necessarily the severes, if you will. It was even people who weren't necessarily dealing with things that, I don't want to say depression or anxiety aren't severe, but not dealing with some of the more stereotypical, if you will, the stigmatized mental illnesses of bipolar, schizophrenia, that there were people there who were dealing with also anxiety, depression, other issues as well. And so with this, the whole realm of stigma, actually, I kind of want to go back for a minute, because obviously, hospitals started closing in the 50s for the states, and ultimately there are very few, if any, state-run hospitals left in the United States. I know here in Virginia there's a handful, but there have been a lot more rules and laws and regulations that have helped and aided with the treatment of individuals who are living in those facilities. That it isn't just, they're there and they kind of get to, run their own show, that there are a lot of rules and regulations, whether they're state-run or whether they're privatized institutions, that are there to protect the clients. In fact, it's almost quite the opposite now, where the clients have more rights than the staff, even at times, based off of my experience there. That if something were to happen where there's an altercation involving a client and a staff member, that the staff member would be checked and tested, make sure that they weren't in the wrong, and even have cameras installed to see what actually transpired in those events, so that there is a full record, because of not because of privacy rights, but because of client privileges and client rights, if you will. Those are things that are in documents and in laws now that protect them from a sort of maltreatment and mistreatment in mental health facilities. So again, taking a lot of strides from where we were about 100 or so years ago to where we're at tonight. things, especially in any sort of hospital setting, whether it's just a psychiatric hospital or whether it's a ward in a hospital that is for psych, that there have been staggering improvements with regards to the rules and regulations that are in place now for the treatment of these individuals. So that has definitely been a major improvement, though the stigma still kind of remains of I'm sure we've all kind of heard and seen some of the horror stories that have happened, or horror stories of some of those psychiatric hospitals from back in the day. There's some really great documentaries out there about some of the poor treatment of those individuals, unfortunately. But that stigma still kind of remains when anybody says anything about mental health or psychiatric treatment or hospitalization for mental health issues. That sort of stuff still kind of sticks with a lot of people in the public. Now we can go to the next one. So, again, there's obviously the different types of the stigma for mental health and mental health treatment. So the first one is that public stigma, right? So the stigma of other people in the general public, I suppose, that negative or discriminatory attitudes that others have about mental illness. And a lot of this kind of comes from what we just kind of mentioned, the perceptions based off the information that they've taken in. The documentaries, the talks about mental health, maybe perceptions within their own family about mental illness and mental treatment that, maybe it's made up, or it's just a hoax, or it's for people who are weak, whatever sort of the stigma might be with that. That might be, that's maybe the stigma of the general public or potential public stigma. And they have, again, all these negative attitudes for people who are dealing with mental illness or need mental health treatment, or maybe even those who are working in the field. I can't tell you how many times that people have referred to, who have these stigmas against mental health and mental health treatment, calling psychologists or psychiatrists shrinks, if you will. It was kind of like brushing their years of medical school and graduate work just kind of under the rug. Like they don't know what they're talking about. They're just kind of almost like calling a regular medical doctor a quack, even though they have a lot more medical experience, if you will. So that's kind of part of that stigma in and of itself with regards to the public. Then there's even the self-stigma. So bringing it down to ourselves. So the negative attitudes that maybe we have, right? The shame that maybe I feel for maybe dealing with something and maybe wanting to get treatment for it, or trying to get treatment for it, or even I am getting treatment for it. And maybe the fears of some of these, attitudes that other people have, or maybe the attitudes that I have. Maybe I feel like I should be better than this. I shouldn't have to be dealing with a mental illness, or I shouldn't be having to deal with something. Really kind of putting myself down, having a negative attitude about myself. That is something that a lot of people struggle with, for sure. I've seen a lot of clients between 2012 and now, and it is something that is very, very common, is people dealing with this sort of sense of that self-stigma, having that sense of shame that they're dealing with a mental illness, and that they have this kind of overwhelming, almost like not necessarily guilt, but just, I think shame is just kind of the best way to put it. Shame about how they feel about themselves, or that they shouldn't be feeling this way, maybe kind of based on some of those public stigmas, if you will, the perception that, hey, I shouldn't be dealing with this, but I am dealing with it. I feel bad about it. I shouldn't be dealing with this. I feel shame and guilt, and now I'm maybe hiding it. And maybe if I'm dealing with a depression, maybe I'm really hiding it because I don't want other people to think that I'm depressed because I feel shameful about that. And then sometimes maybe people don't necessarily know I was dealing with something until maybe it's too late, unfortunately. That is also something that is very common as well. I was working at a private practice up near a university when I was living in Pennsylvania, and during a week when I was off, there was a student who went to the university who was dealing with depression. Nobody knew it, and they ended up unfortunately taking their own life. And most of my clients were up there were college students, and everybody had heard about it, but even some of them hadn't known about it, and talked about how this individual wasn't someone who, they didn't feel like that they were depressed or anything like that. They shared that they posted something on social media at like 2 or 3 in the morning about what they were planning on doing and how bad they felt, and that was moments before they ended up unfortunately taking their own life. And it really came as a shock to everybody around them. But when they kind of mentioned that there might have been some of that self-stigma and shame around that person dealing with some of that depression, or a lot of that depression. Then there's also the institutional stigma. So this is more systemic, if you will. This involves the policies in government, which is never a fun topic to talk about whenever it comes to policies in government, but it's also an important thing because there are things, obviously nowadays, there are more things that are in place to protect clients as well. I mean, that's one of the big things about HIPAA rules, HIPAA laws, HIPAA violations if you break HIPAA. But there are obviously certain policies and procedures and laws that are still in place in certain parts of this country and even certain parts of the federal government that are still kind of stigmatized against people dealing with a mental illness. Obviously, there's certain things, like I said, like for client rights in the hospitals, that there's also non-discriminatory rights when it comes to hiring and employment, but there are still other areas where there are some certain policies in place and certain laws in the books that are very anti-mental health, if you will, or anti-mental illness, and also with private organizations as well. It doesn't just involve the government; it also involves private institutions, private organizations. And sometimes this ends up leading to maybe I'm just going to say hypothetically that someone gets brought in and then they end up dealing with a mental illness, and then they're able to find a way to let that person go, even though that they are dealing with a mental illness. If they needed some time off, or they needed this, or they needed that, just kind of there's loopholes that they have created for situations like that, unfortunately. For some, not all, of course, not all, but some have those things, which is unfortunate because that's that institutional stigma for mental health treatment. Some places, again, more recently, a lot of places, they maybe have talked about the importance of mental health treatments and mental health awareness, being able to take a sick day for mental illness, if you will. That is something that if anybody here has a full-time job and you are feeling overwhelmed and stressed or not like yourself, that's cause for a sick day. You don't have to be sick with the flu or COVID in order to take a sick day. That can be a mental health day. Now, that's something that a lot more modern companies are kind of talking about, or places with more, health conscious HRs are talking about that. Yeah, you can use your sick time for mental illness or a mental health day. But there are certain places that are maybe a little bit more that old school traditional mentality where it's like you're sick, you got to be sick. So there are, again, strides kind of being made, but there's still some ways to go there. And so I also kind of wanted to talk about this a little bit as well. So this just kind of laid out the different types of stigma a little bit better, a little bit easier, with or difference between stereotypes and also discrimination. So when it comes to the public stereotypes of mental illness, is that people with mental illness are dangerous, incompetent, to blame, they're to blame for their disorder, and also unpredictable, right? Again, sort of that public perception. If I was to say, ask people to generalize to someone dealing with a mental health disorder, a lot of people in the public would probably describe someone who fits these characteristics, which is unfortunate, right? Because that's not the truth. That is not the truth, and that's obviously why I'm here, is to talk about that. That's not the truth. That this is not where the perception, or this is not the actual fact. That's the perception of many people in the public, unfortunately, but it is not the fact that people with a mental illness, they're dangerous, they're incompetent, they're unpredictable, that they are to blame for their own disorder. For pretty much everybody that I've dealt with, it is not their own fault. It is not their own fault that they are dealing with something. And it is not their, a lot of mental illness, it isn't necessarily unpredictable either. It can be very predictable. It can be very predictable with regards to like certain triggers and certain instances like that. So certain aspects of mental illness can definitely be very predictable. But the discrimination that kind of comes from that when it comes to the different types, so when it comes to stigma for mental health, is that employers may not necessarily hire somebody if they disclose that they are dealing with a mental illness. Sure, they're required to ask that in the pre, in like screenings and stuff like that. Like, are you suffering from some sort of disability, physical or mental health? And if you say yes, I'm dealing with a mental health disability, they might see that and be like, well, we don't want somebody who's unstable here working for us. We're not going to get back to them. That's obviously very unfair and very untrue when it comes to mental illness and mental health and mental illness, for individuals dealing with that nowadays, obviously. So also landlords may not want to necessarily rent to people who are dealing with mental illness because of that. Healthcare system may offer lower standards of care for those individuals as well. That's very heartbreaking to hear, right? That's something that is still actively going on these days. That this is stuff that is going on, that this is the perception of the public, and this is stuff that is going on within the realms of the public. Then we kind of get to the self here, is that maybe if I'm dealing with a sense of self-stigma, is that maybe I'm feeling dangerous, incompetent, or I'm to blame for my own mental illness. And that kind of partially comes from the stereotypes that we get from the general public. And where do we get that from? We get that from how we grow up, who we spend our time around, media, society, etc. We kind of maybe start to feel this way, that if other people talk about blame, that the person's the individual's to blame for their own mental illness, or that they're incompetent, etc., and maybe I feel like, well, I'm dealing with a mental illness, or I suspect a mental illness, and maybe now I'm going to feel incompetent or to blame or dangerous. And these thoughts can lead to lower self-esteem and also lower self-efficacy, which is like the why try, like someone like me is not worthy of good health, if you will. So really kind of that negative self-talk that ends up developing as a result of having those the negative self-stereotype, if you will. And obviously we have institutional, which is the stereotypes are embodied in laws and other institutions. Kind of mentioned that on the other slide, pretty straightforward. And this is intended to undermine intended and unintended loss of opportunity for the individuals, right? So opportunities for different cares, different treatments, different opportunities regarding work environments, different things like that. It all comes from that institutional stigma, if you will, the different stereotype of it and the discrimination that kind of comes with that. And again, these are some of the effects of the mental health stigma on the individual. So there's this internalized negative beliefs, which we kind of talked about on a previous slide, like, I'm not deserving of treatment, no one wants to treat me anyways, so that's sort of low self-esteem, low self-motivation, low self-confidence, all that sort of stuff, that, blaming myself and internalizing these negative beliefs that I am, I'm unwanted by society, if you will, and then maybe I'm not even worthy of being a part of society because of my mental illness. We also end up becoming socially isolated and also have difficulty with social relationships, again, because that tend to retreat. That if I don't feel worthy to be in society, then why would I want to engage with anybody even? Maybe I have a close friend or two, but maybe I'm going to really disengage from even some of the more extended relationships that I've had and just kind of pull back. I don't even want to leave my own home anymore. Maybe I just order Uber and DoorDash and Grubhub and Instacart and have everything delivered, and I won't want to go anywhere. Try to work from home, stay as isolated from people as possible. And all that continues to lead into low self-esteem, that low sense of self-worth, that I can't do anything, that I'm no good, that I'm not good at anything, period. And that feeling of hopelessness too, that there is no hope for me. The feeling of shame, I talked about the feeling of shame previously, and how, again, this all kind of expands upon itself as well. We're likely to also they're less likely to remain engaged in treatment or potentially pursue treatment as well. Because if I am dealing with a mental health issue and I already feel like, feel that sense of the public stigma, and I feel the stigma myself, going into treatment or contemplating treatment or keeping up treatment would only kind of perpetuate that stereotype, right? That I am mentally ill. I am dealing with a mental health struggle. And that is where that is a really difficult thing to see in the field, to work with. I've worked with people that say, yeah, I pursued treatment a little bit. Then I felt bad about it and I left for a little bit. Now I'm back 2 years later. It's like 2 years, that's 2 years we could have worked on ourselves and gotten better. But a big part of that is that stigma and that sense of that feeling of shame that a lot of people feel when it comes to mental health treatment. So, and this is also a very kind of dangerous one as well, because at this point it's like, okay, I don't have the motivation to go seek help. I don't want to seek help. I feel the stigma. I feel almost like the weight of the world on my shoulders to not go to treatment or to engage in treatment, because that just kind of feeds into the stereotype. And that's almost like potentially even kind of like conceding, right? Like a helpless animal in the face of a predator, just kind of keeling over and accepting my fate that that animal's fate that it's going to be dinner, but in my fate that I have a mental illness. And that can be really hard for a lot of people in this situation to wrap their minds around and accept that they are dealing with something. And sometimes that kind of is that, I don't want to say the nail in the coffin, but it is sometimes that big enough of an event that does say, hey, I am dealing with a mental illness. There's also the increase in mental health symptoms as well. Again, as we tend to socially isolate ourselves, and we continue to not pursue treatment, that there's a extremely high likelihood that symptoms are going to continue to get worse, right? That obviously, if nothing is getting done, nothing changes if nothing changes. That is an old adage that I use all the time, pretty much every week whenever I'm talking with a client who talks about change. Nothing changes if nothing changes. And so obviously there will be an increase in mental health symptoms if nothing changes with a person with a person not wanting to pursue treatment. And again, with that isolation, we're social creatures at the end of the day. We like to, there's something about being able to get out and engage with people, or engage in activities that we like and enjoy that makes us feel good, right? But if we're not doing any of that, it's going to make us feel even, make us feel bad and make us feel even worse. And that's going to make those symptoms increase. And then the last point kind of leads to some of those unemployment potential and also difficulty at work as well. Maybe not necessarily as much unemployment nowadays because maybe some of these people are finding work or able to work now because they can work remotely, which is interesting. So I can remain isolated and maybe have a job where I'm not necessarily as engaged in the workers' potlucks or the company picnics or celebrations or all that sort of the stereotypes that kind of come with working at a business or an organization, that face-to-face contact, and I can kind of keep that barrier, right? I'm working with a couple people right now who have that barrier, or kind of at this point where they have a lot of these other sort of symptoms, if you will, of like a negative sense of themselves and the stigma based around their mental health, and their work kind of revolves around working remotely. But otherwise, there can be these difficulties at work, challenges at work. Again, if we're not feeling good, if our symptoms are increasing, maybe one of the symptoms is irritability. And that can lead to, obviously, some challenges at pretty much every job. If I'm becoming more irritable, more frustrated, obviously maybe some of the difficulties at work could involve, if I'm feeling low motivation, maybe I'm coming into work later and later and later. That's definitely a difficulty at work as well. So there are a lot of different effects that stigma against mental health can have on an individual dealing with mental illness. So, and wait, there's more. Just when I forgot that there was, I thought we had it all covered, there's actually more that I forgot about. But there's also the lack of understanding by family, friends, coworkers, and others, right? Our friends might be kind of going on about their regular lives, and then I withdraw myself because I'm dealing with some mental health issues, and they might not understand that. Like, what? You don't like us anymore? You don't want to be our friend anymore? What gives? Same thing with, again, family, friends, coworkers, that they might have that public stigma we talked about against mental illness, and how it's kind of perceived, if you will, and that can lead to them having a poor understanding of what we're dealing with and how we're feeling ultimately at the end of the day. Less empathy from them, if you will. There's also maybe, again, fewer opportunities for work, school, or social activities, or trouble finding housing too. Again, how are we? It's going to be really difficult for us to find those opportunities or find the motivation for some of those opportunities if we're kind of already withdrawn and stuff like that. But again, if we are kind of open with our mental illness and kind of disclose that, or if it is something that we do struggle with at work or school or something like that, or at least with work, I should say, again, talked about how work could potentially be very, we might not be a hireable candidate by certain places if that is something that they are very concerned about because of the stigma. And again, talked about it with regards to like medical providing and also potentially housing as well. Talked about how landlords might say, oh, hey, this person's dealing with a mental illness. I don't want this person tearing up my apartment. It's unfair, but it is going to have part of that stigma too. Again, bullying, physical violence, or harassment, that's pretty, that's unfortunate as well. But that is definitely something that comes along with the unfortunate territory of that that the effect of that mental health stigma. Already talked about health insurance, maybe not necessarily adequately covering one's mental illness treatment. That is definitely something that is big too. That is definitely something that is big, and that's one of the reasons why I strongly dislike insurance companies. If you talk to most clinicians in the field, we will tell you that insurance companies are the banes of our existence. Whether it be reimbursements, whether it be coverages, whether it be no matter what it is, there is always seems to be without a fail a challenge regarding insurances and insurance companies when it comes to mental health treatment. It's not necessarily treated like other illnesses, which is unfortunate. And it is, again, a challenge that obviously clients experience and also us as providers experience as well. And then there's also that belief that one will never succeed at different challenges, or that they also can't improve their symptoms or situation. Again, that is a myth. That everything on this, everything that we kind of talked about, these are myths, right? These are those stigmas, and trying to get away from that. That people dealing with mental illness can succeed. Oh, by God, they can succeed. So many people succeed. If the numbers are accurate, that 1 in 4, 1 in 5, it seems to kind of teeter back and forth between about 20 or 25% of the population does deal with some sort of mental illness, by the way. Let's get that straight. 1 in 4 or 1 in 5 people deal with a mental illness. So we have, how many people we have here? We have 15, 16 people. So we're looking at 4 people here. At least 4 people on average are dealing with something. 4 or 5 people are dealing with something. That's quite a bit of people. And to say that that amount of people, that 20 or 25% of the population can't amount to anything, can't succeed, can't improve their situation, it's hard to imagine. It's hard to believe, and it's not true, right? It's definitely not true. We could rattle off so many different, celebrities even who have dealt with some sort of mental illness. You type in celebrities with mental illness and get a laundry list long of celebrities who have dealt with some sort of mental health struggle, either at a point or for their entire life. And those people have succeeded. Those people have succeeded. They're making millions of dollars. They're successful in their careers, I should say. And hopefully, a lot of them are succeeding with regards to their mental health treatment as well, because that's one of the big important things. Whether we succeed at having a long-lasting career or whether we bounce around from job to job, make sure we're succeeding at our mental health treatment and being able to improve our mental health situation. That's something that's important. So we can go to the next slide here too. So how do we overcome stigma? There's been a lot of negative things we've talked about, a lot of these facts and also myths, as we've kind of talked about on the last few slides, about what mental health and what mental health treatment has looked like, what it looks like maybe kind of in the sense of the eyes of the public, and where it kind of goes. Obviously, I think everybody here kind of knows that, hey, public perception's wrong. The policies in certain places are wrong, and maybe the perceptions that maybe individuals have about their own mental illness, maybe that's wrong because of what society's done. So how do we overcome this stigma? Well, it's almost like any stigma. It's kind of like the elephant in the room. If we don't talk, it's there, but we don't talk about it. But the biggest thing we can kind of do about it is talk about it. Be open about it. Talking about mental health, talk about mental illnesses. People talk about sharing stuff on social media. I have a little bit of a Facebook page that I kind of put out there. Not my personal one, of course, but one that I kind of post. I'll post some silly stuff on, but also some really serious stuff on as well in regards to mental health and mental health treatment. Something I share with my classes a little bit sometimes too. But it's something that we need to talk openly about. And it's okay to not be okay. And that's a big quote in the field, that it's okay to not be okay. And being able to talk about it, it opens up that dialogue. It makes it more normal, right? Because if it's not normal, if you will, then it's going to be stigmatized. Or we're going to rely on some of the public perceptions of where things have been for many, many years, many decades, many millennia, about possessions and, really terrible treatment, people dealing with, people deemed as crazy if you're, when somebody mentions mental illness. No, I'm dealing with a mental illness. I'm not crazy. I just get anxious when I get on the highway. I'm not crazy. I just get, I just get racing thoughts whenever a teacher says quiz. I think many people get anxious when a teacher says quiz anyways, but that's besides the point. But really, talking about mental health, that's the big thing. That's really the big thing. Being able to normalize that mental health and mental illness doesn't mean, I'm violent. It doesn't mean that I'm unstable. It doesn't mean that I don't know who I am or what I want to do with my life. It means that I'm struggling with something. And just like if I'm dealing with cancer, some sort of medical ailment, I need some treatment for that. Cancer patient needs chemo, maybe some surgery. I maybe need some therapy. I maybe need some pharmacological medications along the way. Maybe there's some interventions I need to do through therapy. Maybe I need to cut off some toxic people in my life. Maybe I need to change my habits. And I need to change my routines, incorporate some healthy routines, get rid of the bad routines. But it doesn't mean that I'm a lost cause, like the stigma kind of states. So being able to talk openly about that, be open and honest with that is a really big thing. Spreading the right information, the healthy information, and not kind of perpetuating the stereotypes, if you will. Educating ourselves and others is a big thing too, and that kind of expands into the talking openly and sharing stuff, right? If we're sharing stuff on social media that are from legit sources, from like NAMI or the NCA or NCA or the National Counselors, things like stuff like that. If we're sharing things from like Psychology Today, things that have research behind it that are facts about mental illness, and not just a meme about a person dealing with mental illness being crazy. We're going to be able to maybe reach some people and educate some people and be able to change those perceptions, presenting the facts, not the myths. We got to present the facts, present that true information, and that's part of educating ourselves too. Knowing where to find some of that correct information on mental health and mental illness, or substance use as well, because that kind of gets encapsulated. A lot of co-occurring disorders out there, so substance use goes hand in hand with a lot of this that we're talking about tonight as well. Don't want that to be lost. And so being able to educate ourselves on all that. You have great resources here, Purdue Global Libraries, be able to look up some really great research on mental illness and be able to look at some journals online or certain research findings. Psychology Today is a pretty good place that has findings. NADAC has some really great findings as well, that you can build yourself up with a wealth of information and use that in conversations about mental health and mental illness. We also need to be conscious of our language as well. And I kind of talked about it a little bit, that we need to remind people that our words matter, and the words people use are matter. That if I'm dealing with a mental illness, somebody calls me crazy, that's not right. That's not appropriate. That's, again, part of that stigma. So that kind of falls in part of the education as well, and being conscious of educating that language, and also being careful to not use that language ourselves too. That if somebody says they're dealing with a mental health crisis or mental health issue, that we're empathetic. We're conscious of the language that we use, and maybe those people can kind of teach people to be conscientious and empathetic with the language they use towards people who are dealing with mental illness. And then the last thing I kind of have here is encouraging equality. So again, between physical and mental illness, drawing comparisons to how they would treat somebody with cancer or diabetes, just like I kind of did a few moments ago. That, again, it's crazy how, I hate to use that word, crazy there again, but it is very frustrating how many people will see an illness like cancer or diabetes and talk about the treatment for that, and maybe kind of how logical that kind of looks, versus when it comes to mental health treatment, and there's some sort of disconnect. But they're both illnesses at the end of the day. They're both illnesses, whether it's diabetes, whether it's depression. They're both illnesses at the end of the day, but they both need to be treated as such. There's different treatments for diabetes, different treatments for depression. Just because they differ in the actual treatment approaches doesn't mean that it's not treatment, and it doesn't mean that it's not something that can potentially get better with some changes and with some treatment options, whether it be medical or other lifestyle changes, like I kind of mentioned. And again, another big thing about the talking openly about stigma is something I wanted to kind of touch on. There was something that I was actually kind of creating a little bit of a slide for. Didn't get a chance to finish it. A little disappointed in that, but that's okay. But I mentioned celebrities earlier, that we've had a lot of really prominent people that have made the news in relatively recent memory. Obviously not recent like the last couple of weeks, but recent memory about mental health and mental illness and their advocacy for it. Lady Gaga is a big one that comes to mind. She had an interview with Oprah where she talked openly about receiving mental health therapy and also being on medications. That's the sort of dialogue that we need to have. People talking, and also even a little bit more recently than Lady Gaga was Osaka, the tennis player who withdrew from tournaments because she was dealing with mental health challenges, mental health struggles. And there's a great article in Time magazine about her as well. So those are just a couple of much more recent examples of people very prominent in society, relatively prominent in society, pretty prevalent, if you will, talking about mental illness. And the more people we have talking about it like that, the more likely it is that we can kind of chip away. It's like trying to carve out, the presidents in Mount Rushmore that is blasted away by dynamite and hand chiseled and hand picked. It takes a lot of work. It takes a lot of work to create something that was, to reshape something that was already there for such a long period of time. But with each hammer, with each hammer pounding and each rock that's falling, we're gradually making that dent and that impact. So, some of the last kind of points here are, again, showing some of that compassion for those who are dealing with mental illness. This kind of goes without saying, kind of goes to what I was saying on the other slide with regards to being empathetic for those individuals who are dealing with mental illness. Again, we're being conscientious of our language that we're choosing, but also having that compassion, being supportive for those individuals. That is something that can definitely help with regards to overcoming that stigma, that sort of self-stigma. Because remember, we talked about the stigma, the stigma of the self, and how that can have such a crucial impact on the individual potentially pursuing treatment or not. But if we show some sort of level of compassion for that individual, for that friend that maybe we have, that person maybe is a stranger, I don't know. If we show some sort of compassion, maybe that kind of changes their perception of things. I still love you even though you're dealing with some stuff right now. Being honest about treatment. So again, normalizing mental health treatment, just like other healthcare treatments. Again, piggybacking off what we kind of talked about earlier. Talking about, like I said, with Lady Gaga being open about her mental health treatments, both medication and therapy. That's something that can be normalized if we continue to make it normalized as well. That dialogue doesn't have to be with people who are on Oprah, but it can be with us as well. Because again, there is sometimes that disconnect between the stardom and average Joe, Eric over here. If I have a conversation with people that I know about mental health or mental health treatment, or if I'm in treatment talking about it, it can kind of help change that individual's mind or work at that individual level. Letting the media know, obviously, when they're letting the media know if they're using stigmatizing language or presenting stories of mental illness in a stigmatizing way. If CNN runs something or a local NBC station runs something about mental health or mental illness, and it feels like something like this could have, this isn't right, or this doesn't feel right, or something could have been worded differently. Maybe they use the term crazy in there about these crazy folk up here. That maybe warrants some sort of action to reach out and be like, this isn't appropriate, this isn't right. A lot of times, stuff like that will get called out on social media. So that is definitely something that can help change that. And in choosing empowerment over shame. Again, I know very hard for the individual, especially if we're struggling to potentially pursue therapy or pursue some sort of mental health treatment ourselves, but choosing that empowerment over a sense of shame. And there's a really great quote here from Val Fletcher. I fight stigma by choosing to live an empowered life. To me, that means owning my life and my story and refusing to allow others to dictate how I view myself or how I feel about myself. So that's a really good little quote, and I feel like that's a really, really great thing to kind of end on here. Is choosing that empowerment, choosing to fight the stigma, and choosing to fight for your mental health and also the mental health of others. And these are references.
Thank Thank you so much, Eric. This was fantastic information. It was so interesting to learn about the history of mental health and these stigmas and see the way they're still playing out today. Into the chat, I'm putting a couple of links. I think that our meeting might automatically close down at the hour. So if we lose everybody, I want to make sure you've got these links. The first one is for the Student Assistance Program here at Purdue. I saw a little chat during the session about some people looking for someone to talk to. Definitely check out the Student Assistance Program. It's free to you as a student. You can talk to someone 24/7. So check that out. The second link is for our takeaway. That's all of the slides we went through tonight, and it also includes all these links that I have here at the end that can just connect you directly to the Academic Success Center and Learning for Success. And then the final link is just for our exit survey. We're always looking for feedback on our webinars and to get information about the times and the topics that are most interesting to you. So I know we don't have a lot of time to turn it over to questions. I did see a question come through during the presentation about any data on telehealth and people who are using telehealth. I wonder if you might speak to that a little bit, if you could direct the student to where they might find more information.
Information about statistics on telehealth or about pursuing telehealth?
I think it was statistics about telehealth.
Interesting. So I can kind of speak from my personal experience because I work doing just strictly telehealth now. I haven't gone back to the office since early last year, and the demand for telehealth, I know just based off a clinical perspective, has exploded. I've been with a couple different places, and there's definitely a lot of places popping up, a lot of places that had some sort of telehealth now expanding into therapy and psychiatry as well because of that need. Obviously it's been very difficult for people to get into offices or get into the virtual offices, if you will, of providers, both on in private practice and also through like insurances and organizations. So I definitely know that there have been, it just has really exploded with regards to people pursuing, not just traditional in-person therapy, but also telehealth, teletherapy, telepsychiatry as well.
Awesome, thank you. I'm going to flip through a couple of slides quickly here just to get to our one about our upcoming sessions for this mental health awareness series. Like I said, you'll all have copies of these slides as well to use those links or find out how to connect with us. But here, like I said, this was our first event for the mental health awareness series, our first talk. On Mondays, we're also doing guided meditation sessions. We had our first one yesterday. I see some familiar faces here tonight that attended that one. I also saw some chat during the session about meditation and how helpful it can be. So if that's something you're interested in, check it out on Mondays. They're 15-minute sessions. It's a guided meditation with an affirmation. So we're focusing on things that I think will be helpful for students to meditate on. Up next week on Tuesday, we have a later session time at 9 p.m. Dr. Bridget Rivera is joining us to talk about the importance of self-care. And that session is going to be a joint session with the psychology club here at Purdue Global. So if you're a psychology student, if you're interested in psychology and not part of the club yet, it's a great opportunity to get introduced to the club, meet some students, build your community here at Purdue Global. So we hope we'll see you next week as well. So thank you again, all of you, for joining us. I'm going to pop these links into the chat just one more time. And thank you so much for making the time for our session tonight. We'll be looking forward to seeing you throughout the month here for mental health awareness. So thank you again, everyone. Take care of yourselves and each other, and have a good night.
Thank you very much for having me. I did put my email in the chat as well in case anybody had any questions as well, anything following up. But yes, thank you very much for having me again tonight, and good luck, everybody. Hope everybody learned a lot. Thank you again.
Thank you.